Hello, my name is Nancy Jacobson, and I'm an assistant professor of emergency medicine at the Medical College of Wisconsin. I'm an ED medical director and the system director for quality, safety, and experience. Today, we're going to talk about patient experience in the emergency department and why it matters. When we start to think about why patient experience matters in the emergency department, I think it's helpful to reflect on your goals. Why did you go into emergency medicine? And what is it that you hope for in your career? When I pose these questions, most often I get the following responses. I went into medicine to help people who need me, to provide hope and comfort, to find happiness in fulfilling work, and to make the correct diagnosis and successfully treat patients. Likewise, when I ask people what they hope for their career, they want to be employed, earn money, pay off loans, avoid a lawsuit, and ultimately, they want to make the correct diagnosis and successfully treat patients. Patient experience can enable us to meet our goals, both for why we went into medicine and for what we hope in our careers. When considering the importance of patient experience, it's important to consider empathy and motivation in the workplace. To start, I'd like to share a wellness initiative from my own emergency department. Each February, our resident wellness committee does a wellness intervention in our emergency department. And for a number of years, we did one called #WhyIDoIt. We asked every single member of our team, regardless of their scope of practice, why it is they chose to work in our challenging emergency department environment. And we got over 100 replies. Two of my favorite replies are here. Because if it were my family member, I'd want someone like me to take care of them. And the ED is the best place to make a difference in people's lives when they are feeling their worst. It's the essence of why I got into medicine. And that one even got a second vote, an arrow, with this exclamation point. And this really highlights why we went into medicine and what we hope to be for our patients. And I think in both of these instances, it will result in a positive patient experience. The literature shows us that association between emergency physician self-reported empathy and patient satisfaction exists. On this chart, we can see that the Jefferson scale of physician empathy score increases, and that's associated also with an increase in predicted probability of very satisfied rating on patient satisfaction surveys. Additionally, embracing the importance of patient satisfaction in the emergency department can enable us to be effectively employed, avoid lawsuits, and to make the diagnosis and more successfully treat patients. Let's look at how that happens now. Value-based pay for performance and quality is here. Hospital systems use patient experience surveys to evaluate value and quality of care. In the inpatient setting, the HCAHPS survey is utilized. In the outpatient ambulatory practice setting, CGCAHPS is utilized. And in the emergency department, EDCAHPS is utilized. In each of these surveys, there are specific questions about physician-impacted patient experience. For example, in the EDCAHPS survey, we can see that there are 4 questions that are included in the example on the right. Questions on, did doctors treat you with courtesy and respect? Did doctors listen carefully to you? Did doctors explain things in a way you understood? And did doctors spend enough time with you? These questions are not only specific to physician-impacted aspects of patient experience, but the survey collection tool allows for individual physician metrics to be reported out. Depending on the workflows and processes at your hospital system, individual metrics or measures may drive incentive measures for the fiscal year. Additionally, we know that better communication was associated with higher global ratings of healthcare. And in a few slides, we'll see how better communication and better global ratings of healthcare also impact patient compliance and outcomes. Research done by Stelfox et al. In 2005 shows that there is a relationship between patient experience, patient complaints, and lawsuits. For each 1-point decrease in satisfaction ratings, there is a 6% increase in patient complaints and a 5% increase in risk management episodes. Additionally, physicians in the lowest 1/3 of patient experience ratings were 110% more likely to have lawsuits than those with top satisfaction ratings. Further, 75% of complaints were related to communication issues. One common goal, both when we think about why we went into medicine and also what we hope for our careers, is to successfully diagnose and expertly treat patients. We know that there is a positive association between patient experience, clinical effectiveness, and patient safety. Further, this association is consistent across a range of disease processes, study designs, and healthcare settings. This is demonstrated in a 2013 study by Doyle, Lennox, and Bell titled A Systematic Review of Evidence on the Links Between Patient Experience and Clinical Safety and Effectiveness. A meta-analysis by Hascard et al. In 2009 illustrates that physician communication correlates strongly with adherence rates by patients in acute and chronic disease. Over 100 observational and 20+ experimental studies published demonstrate the correlation of communication with patient satisfaction with compliance, and compliance with treatment regimens has significant influence on quality measures in chronic disease and outcomes. Therefore, we can see the cycle where good communication leads to great patient satisfaction, treatment plan compliance, clinical effectiveness, therefore patient safety, improved outcomes, and improved quality of care. Patients want care, not just treatment. In today's healthcare system, care incorporates both technical elements of care, meaning correct diagnosis and treatment plan, but also personal elements. Patients have choices. They expect that they will receive superior clinical care, but they also want and need people that they can connect with and feel safe and comfortable with. I fully acknowledge that there are challenges to patient experience in the emergency department. Some of the most common challenges I see too many really sick patients. The patients have unrealistic expectations. I'm on a high acuity shift, or I'm on a low acuity shift. I work days, I work PMs, I work nights, I work at a teaching hospital. Or for residents or other learners, I'm trying to learn more important clinical skills. In the instances where the challenges seem to outweigh the benefits of patient experience in the emergency department, I challenge you to ask yourself the two questions. Why did you go into emergency medicine, and what is it that you hope for your career? in addition to practicing excellent high-quality emergency medicine. Dedicating yourself to an excellent patient experience in the emergency department, despite all the challenges, is incredibly important. And I hope I've convinced you so today. Again, thank you for your time and your attention during this discussion of patient experience in the emergency department. It matters.